Okay, good morning. Today we're going to be doing your abdominal assessment. I'll start by gathering my subjective information and then I'll do my assessment after.
Okay.
Have you been having any abdominal pain?
No.
Nothing after eating?
Nope. Not recently.
Any changes in appetite?
No.
Loss of appetite, increase in appetite?
Normal appetite.
Okay. Any recent weight loss or weight gain?
Weight gain probably over the last 2 or 3 years.
Okay. Just from?
Just less activity.
Okay.
Not eating probably the healthiest.
Any difficulty swallowing?
No.
Do you ever feel like food gets stuck when you're swallowing?
No.
Okay. Do you have any food intolerances?
Not that I'm aware of.
No food allergies? Nothing you can't eat?
No.
Are there any specific foods that give you like heartburn, gastric reflux, anything like that?
If I eat like spicy food late night, in the middle of the night, I might wake up, or in the morning I might have acid reflux for a while, but that's it.
Okay. All the time when you eat spicy stuff?
No, it kind of really just depends. Sometimes it is, sometimes it's not.
Okay. Have you had any nausea or vomiting recently?
I have not.
How often do you have a bowel movement?
2 or 3 times a day, probably.
That's pretty normal for you?
Yep.
Is the color and consistency of it the same pretty much every time?
Yep.
Have you had any diarrhea or constipation recently?
No.
Any recent change in your bowel habits? Going more, going less?
No, it's usually stays pretty much the same 2 or 3 times a day.
Do you ever use any laxatives?
I do not.
Do you have any history of any abdominal issues, ulcers, gallbladder disease, appendicitis?
No.
Still have your gallbladder?
I do.
Still have your appendix?
Yes.
Have you ever had any abdominal surgeries?
No.
Do you have a history of colon cancer in your family?
Yes.
Can you tell me who in your family had colon cancer?
My dad's brother, and my dad was like precancerous for colon when he had his colonoscopy.
Okay. When was your uncle diagnosed?
3 years ago.
How old was he?
51.
Okay. Have you ever had a screening for colon cancer, colonoscopy, Cologuard, anything like that?
No.
Okay. Do you take any medications?
No.
Do you take Tums?
Yes.
How often?
A couple times a week, probably.
For any specific reason, just heartburn?
Heartburn or acid reflux. Sometimes if I do feel like I have a little bit of a stomach ache, I'll take one.
Can you tell me all the food you ate yesterday, starting with breakfast and then moving throughout the day?
I did not eat breakfast yesterday. I had a Subway sandwich for lunch, and I had chicken wings and some crab rangoons for dinner, and then a couple pieces of pizza late night.
Did you drink any alcohol?
Yes.
How much and what did you drink?
6 beers.
if this hurts.
No.
Okay. You can roll my shoulder. Okay, just breathe slowly in through your nose, out through your mouth. Okay, now I'm gonna ask you to take a deep breath and let it out. Again. One more time. Okay, take a deep breath. Okay, great. Okay, take a deep breath. Okay, take a deep breath.